Well, we have a very unique topic. It's certainly distinct from so much of the good stuff that's already been talked about today. It's a beautiful angle, psychedelics and wellness. Please welcome to the stage Dr. Rudy Eberwein.
All right. Thank you, man. Appreciate it. Hello, everybody. Wow. So excited to be here. I know I'm the last speaker. You guys have had a long day, got a lot of information. I know your mind is overwhelmed and overloaded. So I'm going to try to make this fun, and give you actionable steps that you can take in your life and share personal stories with you. You know, I was here at Biohacker Expo last year and I presented on iron overload. But this year, I wanted to really make it personal and make it something that is outside of the regular realm of a physician. So my talk today is called Psychedelics and Wellness. Are they a good match? And I coined a term for myself. I call myself now the White Coat Shaman. White Coat Shaman, why? Because I'm trying to get together to fuse Western, traditional, conventional medicine, which is important. We cannot forget about the ancestral, traditional knowledge that has been passed on for thousands of years. So I'm excited to talk to you about this. This is not me. This is an AI representation of what I think the doctor of the future is going to look like. If we can integrate those two different disciplines, I think we'll be in better health. So first, let's define what is wellness. I think you've heard a lot of talks at Biohacker Expo about, it's all about biohacking, optimization. What is wellness? And to me, wellness, I've always said that. It goes beyond just the absence of disease. And it goes beyond just the physical world. It has to be an optimization of physical, mental, and spiritual energy. And as doctors, as Western people, we don't think about those other realms. And this is how I visualize what wellness, my pyramid of wellness should be. I hope you were here for the talk today when the Bertonazzi brothers, my business partners, and my brothers have been talking about the state of disease that our society is living and how we can utilize all of those different modalities to really bring wellness to our patients. So at the base of the pyramid of wellness, it's always the pillars of health. It's nutrition, it's exercise, and sleep. You need to improve those. And we've gotten really good at counseling patients at getting better at this. The second block, this is what our company, and we've become expert at, hormone replacement therapy. Hormones are important. Without hormone, you cannot live a good life. So hormones and targeted supplements, that's the second floor. So those two blocks usually are what conventional, traditionally trained doctors focus on. I'm going to help you with this and make you prevent disease and help you feel your best. But what about that top? What about connection? Connection to your social circle, your family and your friends. Connection to yourself, your inner dialogue, the way you see yourself, your inner voice. And even more importantly, connection to the spiritual realm. Connection to the divine, to the sacred. We never talk about this. And this is an important part of wellness. So today I'm going to mostly focus on that top. And our goal as biohackers and as optimization fiends is to increase health span, the number of years that we're going to have as healthy, like really enjoy it. And the goal of biohacking is exactly this. We want to feel great. We want to be optimized for as long as we can. And the goal is that by 2050, we'll all live to 120. I think AI and personalized medicine is going to help us get there. But we know we can't just focus on the physical health. There's no optimized health without mental health. And there, the biohacker finds himself in a paradox. You want to prolong life. You want to live as long as you can. You want to increase your health span. But what about that deep, ancestral, ubiquitous fear of death that we all have? When do we talk about this? How do we lose that fear of death while still trying to not die? You know, in 3 weeks, there's going to be the summit in Miami, the Don't Die Summit. It's an important summit. We need to find ways to not die. But what about that fear of death? And this is where psychedelics, I see, play a big role. I'm going to start first by the definition of psychedelics. And it comes from ancient Greek. Psyche, meaning the mind, and delos, meaning to reveal, to manifest. So psychedelics are mind revealing, mind manifesting. And they are classified usually as classic versus non-classic psychedelics. And the classic psychedelics, as you can see, they include LSD, psilocybin, DMT, that include ayahuasca and bufo, and mescaline that is used mostly by Native American tribes. And the classic psychedelics, their common thing is that they act and modulate the 5-HT2A serotonin receptors. So right there, because it modulates that receptors, you can already see that it's going to have significant effects on mood, anxiety, and overall mental wellness. Then you also have the non-classic psychedelics, things like ketamine, MDMA, and ibogaine that work on different receptors, but the phenomenology and phenotype that you get, they're all about the same. And we're going to talk about the mystical experience that you can get with those substances. And the psychological benefits of psychedelics are very well described. Since the 60s, during this time where there were a lot of studies that were showing those benefits, until Nixon started his war on drugs and all the studies stopped, we know that psychedelics were really important for anxiety, depression, PTSD, suicidal thoughts, addiction. Addiction, one of the most important and most effective treatments that we have for addiction. And the state of our society now with the addictions that we're seeing, we need a paradigm shift. We need new treatments. The SSRIs of this world and just the antipsychotics that we're using, or the extended stays at rehabs that patients just, it's a revolving door. We need a paradigm shift. So we need to keep looking for new ways of dealing with this. And then now, this is my white coat speaking. Let's talk about the biological effects of psychedelics. And we talked already about the activation of the serotonergic receptors, but the second point is really important, that BDNF, brain-derived neurotrophic factors. It's almost like miracle grow for your brain cells. So I want you to picture brain cells. We have 80 billion plus brain cells in our brain. And they all have a nucleus, and you have dendrites, those little outpourings, look like the roots of a plant that just keep going and try to communicate and touch each other. BDNF really helps sprout that growth. So increased levels of BDNF have been associated with neuroplasticity. This is the ability of the brain to adapt and reorganize itself based on stimuli. And all of these are biological effects of psychedelics. Also causes neurogenesis, formation of new nerve cells, decrease of neuroinflammation. Inflammation, we know, is the buzzword of the biohacker, of the optimization physician. We need to decrease inflammation. Well, neuroinflammation can be decreased with psychedelics. And this is neuroplasticity in action. This is an electron microscopy picture of nerve cells of a rat. The first picture, you can see those little budding dendrites, the little outgoing of the roots that are trying to go out. The second picture is 24 hours after a ketamine injection. And you see that those little dendrites are starting to come out, and they go more. So that induces neuroplasticity and new connections in the brain. And this picture to me is fascinating because this is trying to represent the number of networks and connection between different areas of the brain. The picture on the left is a normal brain doing normal activity. The brain tries to really not expend too much energy and be very, economize the number of networks that it uses during regular living. So on the left, you can see there's few connections, there's few networks activated, and you go about your day. This is living in automatic. On the right, this is on psychedelics, on psilocybin. You see that there's crazy connections. All new networks are talking to each other. And it's just like a computer that you add more memory to it, more connections, more dendritic growth of the nerve cells. And that translates into better results for the person. Amazing. So a lot of new connections have been in studies show to really affect the neurobehavior of our patients. Let's talk for a little bit about the default mode network. The default mode network is a really important concept, and I think it was really concretized by Cahart Harris. He's a researcher from London that has done a lot of research with functional MRI and functional EEGs to try to see what defines who we are, what defines our perception of ourselves. And the default mode network, it's a bunch of neurons in different areas of the brain that fire together and make you your self-identity, make you realize that you are separate than the collective, make you be able to almost go on automatic into your everyday life. You know, most days we have the same thoughts that keep coming over and over. We have the same behavior that keeps happening. All this are being run to the default mode network. We live in automatic. Well, when you go onto psychedelics, studies have shown that there's a decreased blood flow to those areas of the brain, and there's a desynchronization of the default mode network. So it's almost like the brain has a short circuit that keeps going around and makes you who you are on your everyday life. With psychedelics, those networks are interrupted and allow new connections of networks. And when you think about this, we've always tried to interrupt connection in the brain. In the 1940s, do you know what the treatment was for intractable depression and anxiety? It was a lobotomy. That's part of this, but before they had all those, they used to do lobotomies. They separate the different parts of the brain so they stop communicating with each other. Then after this came electroconvulsion therapy. Same type of thing. They tried to shock the brain to stop those short circuits and to make new connections to happen. Until they found LSD, that was one of the first psychedelics, we saw that there was a substance that could interrupt and desynchronize the default mode network and now allow hyperconnectivity of new neural networks. So it's like new areas of the brain are talking to each other. That's what we want. That's what we're trying to achieve. So now let's talk about practical ways of taking psychedelics. And again, I'm going to say that here. Everything that you're hearing here, it's for information and educational purposes only. Most of those substances are not FDA approved, so I'm not encouraging anybody to try any of those. I'm going to talk a lot about my personal experience, anecdotal evidence that I've seen in many of my patients, because I have a ketamine clinic in Miami Beach where we use ketamine, which is the only FDA approved psychedelic that we can use in the United States. So don't take what I'm saying as an invitation to go and try it. This is just for education purposes only. So microdosing is one of the most talked about ways of using psychedelics. And it's getting a lot of press lately. And what microdosing is when you lose sub-perceptual doses of a psychedelic, meaning that when you take it, you don't feel the effect whatsoever. You don't feel the psychoactive effects of the psychedelics. And the key is that we're trying to induce neuroplasticity, those new brain connections with those low doses like this. When it comes to psilocybin, it's about 1/10 of the regular dose. Usually a moderate to high dose of psilocybin is about 2 to 5 grams. The hero dose is about 5 grams. So microdosing is 100 to 300 milligram of it. And although we don't have the gold standard of randomized placebo-controlled trials to see that the microdosing strategy works, there's been many anecdotal evidence that it does work. And one of the protocols that I really like was by this researcher, Fadiman, and he came up with a protocol, and it makes sense. It's 1 day on at the low dose, 2 days off to allow your receptors to really recycle and be sensitive again. And you do it for no more than 4 to 6 weeks, not to overload your neural circuitry. So that is a really good protocol. There's research behind it, a lot of anecdotal evidence that this works. And this is the benefits that most people who microdose are reporting. And they are reporting all of those amazing benefits. Don't you want to have those benefits? Increased creativity, increased productivity, decrease in anxiety, depression, enhanced mindfulness. Mindfulness is such an important thing. I'm thinking about changing my MD from medical doctor to mindfulness doctor. Wouldn't that be amazing if you go to a doctor and what he's trying to prescribe to you? Thank you. Be more mindful. People who do microdosing or psychedelics tend to be more nature lovers. They say, I love you a lot more. They call them tree huggers. Isn't that something we're trying to do more in our society? Wouldn't we be better if we had more people thinking like this? Again, the concept of neuroplasticity, to me, is the most important thing of what you're going to get out of this today. And very interestingly, that tech entrepreneurs and really Silicon Valley has started this movement way back maybe 20 years ago, and they all report benefits. Many startup companies will tell you that most of their meetings will happen either microdosing or using the more social dose to really enhance productivity, creativity. So a lot of breakthroughs have been reported to happen because of this. Again, isn't that the state of mental health that we want to be on? Another population that uses that a lot is stressed out parents. You know, we've rationalized, right? We've rationalized the use of alcohol, which is known to be a toxin. You get home, you have your glass of wine because you've had a difficult day, the kids are talking too much, and we've rationalized this. There's a big movement of parents, and especially moms. You know, moms rule this world. Moms rule this world. And if you go on Facebook, you go on TikTok, you will see so many communities talking about this. For me, the MD, I'm always trying to be, but where's the evidence? And when you look at all the studies, they're mixed. We have mixed results. Whenever they try to do those long placebo-controlled trials, many times they cannot reproduce the same results. And we say that maybe it's just a placebo effect. It's hard to really get the science behind it. But this is where the shaman in me comes and says, I don't care if there's placebo effect in this. If you get the right setting, but if you feel better, if you don't have to drink to get you there, if you're able to connect with your fellow humans in a different way, isn't that something we want to encourage? I'm not going to wait for the science to be there 100% to say, yes, I'd much rather you do this. Thank you. Much rather that we have those alternative ways of looking at the world to help us. We need more controlled studies, I agree. We need more standardized regimens, I agree. But we cannot forget about all the anecdotal evidence, all the ancestral evidence that has been passed to us for thousands of years. And we need to look at the legal and ethical considerations. Right now, it's only been decriminalized in a few states and a few cities. But if you live in a state that is still under criminal law, you have to be careful. Also, something that's very important for me, we need to make sure that we respect and include indigenous communities. I'm actually the medical director of a Native American tribe in the Everglades, and they have their own ways of dealing with this. And I respect that. And I've seen that there's so much beauty in this. And I just hope that we can bring that into our Western world, but at the same time respect those indigenous communities that have been dealing with this. And the future of microdosing research is bright. There's research being conducted, Johns Hopkins, the Imperial College of London. We're going to have a lot more studies coming up. So the future is bright. Now, what about the trip? What about the dissociation? What about when you take a regular dose of psychedelics? I know that's what people want to be like. Forget the microdosing. I want to feel it. Well, this is where I'm going to talk about the mystical experience. And many people, when they hear mystical, it kind of turns them off because they're thinking it's something magical, it's dark, It doesn't make sense. I don't want to hear about the mystical experience. Well, the mystical experience is it's a set of clinical scenarios that have been described in studies. And there's actually the MEQ, the Mystical Experience Questionnaire, which comprises of 30 questions that we can give to our patients after a psychedelic experience to be able to gauge it. But basically what it is that you are in a profound state of altered consciousness that is beyond ordinary perceptions. Again, that's the trip. This is when you're tripping out. This is when you see things. And it can be scary. It can be anxiety prone. But studies are showing that there's a direct correlation between the mystical experience and how much you will get out of it. And now at my ketamine clinic and with all the different journeys that I've done with patients, with friends, those are the typical things that we see, the core features of the mystical experience. And the first one that most people report is the feeling of oneness, the feeling of being one with the universe. And it's very ineffable. Ineffability describes this. Ineffability, it's hard for you to describe it into words. After you do an experience like this, you're like, oh man, it was amazing, but I don't know. It's hard for me to put into words. I'm like, I get it. I know. Because you can't put it into words, but you know what you've experienced. So other things like sacredness, most people will tell you that during those moments, they meet with whatever their divinity is. They'll tell me, I met God. I am God. And those words are almost sacrilegious for a Catholic-raised person to be saying that. How can you say you are God? Well, I truly believe, just like Rumi said back in the 13th century, Rumi said that we're not just a drop in the ocean. We are the whole ocean in the drop. How amazing is this? And he knew this almost 1,000 years ago. How do you think he knew this? He experienced it. Because trying to understand this concept is not the same as actually feeling and experiencing it. That's the ineffability of this experience. It's almost like you go to a restaurant and the waiter is telling you about the specials of the day and you start salivating, it sounds good. But when you actually bite into that meat or that food, it's a completely different experience. So the deep knowing of the mystical experience is something that is so important to the psychedelic experience. And why does this matter? Why does it matter? Because most studies are showing that the mystical experience correlates very closely to how much benefits you will get from your experience. And the mystical experience, again, can be scary. You can have a bad trip. But what comes after that, especially when you do the right integration, the right talk therapy, that you surround yourself with all positivity and help you deal with those difficult moments. So in that studies, they reviewed 12 studies, and they saw that 10 out of the 12, 83% of the studies showed correlation between the mystical experience and long-term reduction of symptoms. So again, that study, again, it's 10 out of 12 that showed that the depth of the mystical experience will predict what kind of results you will have. So when I have my patients doing ketamine sessions and I see them, they come out and they're telling me all these descriptions of what they've had. In the back of my mind, I know. I'm like, oh, you're going to get some healing out of this. Here's a landmark study that really, that's after this study that they were able to really start looking at psilocybin to become FDA approved, that it's in the works. It's going to happen soon. And that was an amazing study. They looked at 36 people that were naive to psychedelics, never had psychedelics. And they gave them mostly, all of them, they received psilocybin. And look at those numbers. 67%, more than 2/3 of them showed that it was top 5 most meaningful life experience. It was only behind the death of a loved one or the birth of a child. That's how meaningful that experience was. And 64% of those people reported continued benefits after the experience. How does that happen? Neuroplasticity, new connections in the brain. Another study where they looked at cancer patients and psilocybin, that fear of death. When you're dealing with a life-threatening disease, how can you explain to somebody to just, you will be okay? In that study, same thing. Most of the people who did one dose of psilocybin with integration and with the right support, they reported losing their fear of death. They reported better symptoms, fewer symptoms of depression, anxiety. So they were able to see their battle with this life-threatening disease from a different perspective and realize that they are so much more than this physical body. Another population that I'm very excited about what's going to happen is for autism spectrum disorder. Same thing, we don't have anything great that's working. And there's great studies that are showing that anecdotal benefits on patients with ASD. Again, we don't have all the studies, and there's this really interesting study, SILOT, that we're waiting. It should be completed within the next 2 years, where we're doing randomized placebo-controlled trial. But I'm going to tell you a personal anecdote. I have a really good friend of mine whose daughter has autism, and they moved to Colorado, and she was able to find the right provider and started microdosing psilocybin. I was not convinced because I was worried that maybe she was going to get into more trouble, have maybe more difficulty being controlled. And the changes that I've witnessed on that child that I've known my whole life are magical. You see more life in her eyes. You see more social connections. And I'm like, how are we not looking at this with more? We need to keep pushing the study so we can help that population. And let me take a few minutes to talk about ketamine. Because again, because I'm an MD, I have a license, I can only prescribe things that are FDA approved. And ketamine is the only psychedelic. Again, it's a non-classic psychedelic that has been FDA approved now to use for the treatment of depression, anxiety, suicidal thoughts. And ketamine has been FDA approved since the 70s as dissociative anesthetic agent. And it's the safest anesthetic agent. For kids, for pets, or in war situations, they use ketamine for anesthesia because it doesn't stop your breathing. So it's the safest anesthetic agent that you can use. And at sub-anesthetic dose, at 0.5 milligram per kilogram, ketamine has been shown to have multiple benefits. We need to change the paradigm of SSRIs, selective serotonin reuptake inhibitors, classical antidepressants. More than 1/3 of patients don't respond to it, or they need to stay on it for life with multiple side effects. Is that the best way that we can treat patients? Ketamine, sometimes 70% reported relief of their symptoms after just one dose. And it's been FDA approved for the harder cases, the tougher cases, treatment-resistant depression or anxiety. That's what it's FDA approved for. So at our clinic, we use IV ketamine as a, that's not the one that's FDA approved. The one that's really FDA approved is the nasal spray called S-ketamine, brand name Spravato, and we're getting amazing results. I'll never forget this young 18-year-old kid that his mom brought with acute suicidal ideations. After one session of ketamine, the mom told me it'd been more than a year. She had to quit her job to be with the child at every minute. One session, suicidal thoughts went away. This challenged my conventional view. I was like, why aren't we looking more at this? Is it prejudice that we have that prevents us from looking at this? Those are the studies for the acute suicidal thoughts. It is so effective now in the ER. They'll use it to stabilize acutely suicidal patients. Talking about neuroplasticity, I want to be sure that I let everybody know that doing psychedelics is not the only way to leverage this beautiful function that our brain has. That our brain can continue to adapt and reorganize itself. And all of those other ways are things that biohackers are trying to do, right? During this weekend, you're going to see so many different modalities to help with this. We know that exercise helps to decrease risk of dementia and is good for wellness. Increases neuroplasticity and BDNF. Nutrition, eating more omega-3s. That's why the Mediterranean diet is the best diet for brain health. puzzles, brain games, learning a new language. You always hear that. Learn a new language, learn to play a musical instrument. All what those doing, they're trying to leverage neuroplasticity. Same thing that you can do with different forms of psychedelics. And what I'm really excited about is about this procedure called transcranial magnetic stimulation, TMS, which is a procedure that has been FDA approved for decades for things like treatment-resistant depression, anxiety, OCD, insomnia. And it is the same concept where you apply some magnetic fields to certain parts of the brain, and it helps stimulate the brain to make a BDNF, get that neuroplasticity, and you get the same results: neuroplasticity, improve anxiety, improve depression score. And what I'm really excited about is right now there's a company, they actually have their booth there called BTL, and they really revolutionized that treatment. Before, the treatment used to be a huge machine. It was difficult to do. Look how sleek this machine is. So I just got that machine at my office and we started playing with it. We started seeing the results. It is an old technology, but with a brand new machine, modern machine. So go and talk to BTL and see about that machine. So different ways to leverage neuroplasticity, but neuroplasticity is essential to our mental and spiritual wellness. So although I've been talking a lot about the neurobiological benefits of psychedelics, this is where I'm going to put back my shaman hat and make you realize that the science of psychedelics is not complete. But the most important thing that you get and that indigenous communities have been leveraging is that feeling of oneness, that feeling of unity, that ego death. So you can really understand that you are part of this bigger mystery. And this is where it's going to be real for me. So this is my brother Klaus. Klaus committed suicide 7 years ago. That was the hardest thing that happened in my life. He was 4 years older than me, but he was my twin. We were connected. He was my best friend. He went through his moments of depression and he killed himself 7 years ago. Again, I love Rumi. And Rumi said, it's through the wound that light enters. That was my wound. It's after this that I decided to do my first psychedelic experience. And it changed my life. This event changed my life. So I'm able to look back at it, not with the eyes of sadness, not with the eyes of desperation, but with the eyes of gratitude for such a horrible event. But it made me the person that I am today. Psychedelics have changed my life. Psychedelics have made me a better human, a better husband, a better father, a better physician. And I hope that everybody can experience this so we can all be better humans. And I'm going to leave you with this sentence that was found. It's an inscription that was found on the door of the Sempos monastery almost 1,000 years ago in Greece. And try to read it and understand it. If you die before you die, you won't die when you die. If you die, if you experience ego death, if you see that you are more than this human body before you actually die, then when you're going to die, you know you're not dead. So yes, I am going to go to the Don't Die Summit. I'm going to keep pushing to not die. But I've already experienced ego death, and I know I am light, I know I am God, and so are you. Thank you. Thank you. I think we have 10 minutes left for questions. I don't know if we do questions here. Anybody for questions? I know it's difficult, but I'm going to ask everybody after this talk to keep an open mind. Again, as DMD, I cannot recommend you to do anything like this, but start caring about your mental and your spiritual wellness. Start caring about your position in this great mystery of life. We are way more than this body. I love taking care of the body because that's what I've learned how to do with all this training. I'm an expert at replacing testosterone, weight loss with GLP-1s. I'm an expert in nutrition. I love pushing exercise and sleep, but all these pale in comparison to really taking up brain fitness and spiritual optimization. So keep an open mind, try to leverage neuroplasticity.
Thank you for the most inspirational talk today. It's from somebody who does plant medicine on a regular basis. It's we understand that without death there is no life. So it's very appropriate that the loss of your brother gave you the life that you have right now. I agree with everything. The only thing that's been bothering me that I wanted to ask maybe you is, I don't know if I'm comfortable with the mainstreaming of the psychedelics for the reason of big pharma making synthetic versions of the medicines that are basically, I tell people, God put them here not to look at, but to use. So it's just a little bit of a question of, I'd like to get your thoughts on big pharma maybe entering into the psychedelic medicine factory.
Definitely. Thank you for your question. Thank you for saying this. And we talked before. This is another MD, another white coat shaman who's experienced with plant medicine and changed his life. Very true. But the reality is, I know it's going to happen. And that's why we need the grassroots movement like this to continue. That's why I'm hoping for indigenous communities to be respected and included. But because big pharma knows there's a lot of money in it. For example, you look at esketamine. They never approved ketamine because it's cheap. They approved esketamine because they can charge $1,000 for that. Right now, many industries are looking at really distilling psilocybin, and for you not to have the trip or any other things. I believe in the entourage effect. It's not the one molecule that causes it, it's everything. And I'm very worried about big pharma taking a hold of this, but they're the ones who have the money to do research and to really start putting that. So I welcome some of it with a big grain of salt. I'll see what the results are, but the real push should be a grassroots movement. People like you who are going to keep talking about it. Thank you.
Hi, how you doing here in the front line? My name is Felipe. I used to do, well, first of all, thank you so much. It was amazing and enlightening. I used to do like mental programming seminars, and I was very on the mind and how to trick it and how to improve it, very much Tony Robbins style. But life took me to do also on the side ayahuasca retreats because it changed my life. And I want you to talk about a little bit about set and setting, because I know in the US people are afraid of going doing, like I'm from Colombia, to go do it in the jungle with the right indigenous and all of that. And it's not quite the same experience if you do ayahuasca in a backyard or of a lawyer that during the day, you know, lawyer and shaman. But if you go with the right music, the right shaman, I have experienced both, and it's not even a comparison. So if you can talk a little bit about set and setting and
Definitely. And when you think about indigenous communities, it wasn't even a question. It was a whole community event with nature, connecting with nature. Again, the Western world tends to really isolate and make things very sterile. Set and setting is really, really important and will make your trip, whether it's good or bad. So that's really important. And I hope and wish that everybody could do this. My first experience after my brother passed, I went to Mexico. And I went to a shaman. I was in the middle of the jungle, and I did bufo, the tough one. And that's when gave me, I went there, and truly, again, it's my first time talking about this on stage, and I'm sharing with everybody about this. And it's my personal experience. But with the bufo experience, I went to the light. I saw the white light. And when they've done studies, they look at near-death experience, and they see it's the same effects that you have in the brain. So that for me was amazing. But when I came back again in the US at my clinic, it's a very sterile environment, but we make it very nice. But I'm going to tell you, some experienced plant medicine people have come to my clinic, and they did the sterile and synthetic ketamine, and they had mystical experiences that at the end of the day brought more or less the same. I'm never going to take away the setting, the natural environment, the right people around you. That's what we should strive for. But for a lot of people who are scared to go to a jungle to do this, you can go to a doctor's office where you're being monitored. And for a lot of my patients, that's their first way into looking at alternative ways of making them feel better. Thank you for your question.
Over here. Right here.
I
In the middle, right here.
Very good.
Okay, can you see me?
Oh, yes.
You
yes,
can,
yes,
okay.
yes, I see it
Right here.
right there. Yeah.
First off, I want to thank you for being vulnerable, sharing your story. And my question is, the quote, "If you die before you die, then you won't die when you die." What advice would you give to someone who experiences this? What is the road and the journey beyond that moment? Because I think we bring that up, the ego death, but we don't, or I haven't heard the conversation of what next?
Yeah.
So what advice would you give yourself if you could go back to that moment when you had your ego death?
That's a great question because we talk a lot about integration. Talk therapy after you do this, and I strongly recommend this. But at the end of the day, we all have an inner healer. We know what we need to. So with my experience, and it's only after that I started looking at the science, I guess what it did for me, it desynchronized my default mode network and kept me in a state of openness. And I went and read. I went into Hinduism. I reread my Bible, and I understood that all of those are stories that are trying to all tell us the same thing. We are one. You are beautiful. You are enough right now. You are God. That is so powerful. Whichever way that you can get there, whether you get it with post-integration talk therapy, with a counselor, with a shaman, or if you can do it on your own, the key is to understand this, not just know it. Once you understand that oneness, interrelatedness, and interconnectedness of all things, that is life. And even you look at quantum mechanics now. Einstein, who was the best brain of the century, said that. He became very spiritual at the end of his life because he understood that energy and the particle are one. So science meets spirituality. So yes, I encourage integration. I encourage talk therapy. I encourage community. But for a lot of people, the inner healer can even help guide you there. So I encourage it. It's not the only way, and especially in this country. For example, MDMA, that is on a fast track to be FDA approved for complex PTSD. It did not pass the FDA recently, not because the therapy was not effective, because they could not find the right integration and talk therapy to accompany it with. So because of that, it was put on the back burner. So they are going to reevaluate it with the talk therapy. So integration is really important, but for many people, the inner healer can help get you there also. Thank you. All right. Thank you so much, and thank you for allowing me to be vulnerable and share this.